Good evening, Columbus community. It is Board President Adair, and I am calling the October 6th regular board business meeting to order. Mr. Treasurer, will you please call the roll?
President Adair,
Present.
Ms. Beckerly,
Present.
Mr. Brown,
Here.
Mr. Cole,
I am here.
Dr. Pierce,
Present.
Mr. Ragland,
Here.
Vice President Reyes.
Here.
You have a quorum.
Thank you so much. And this evening we have Carl Moore Jr., who is a student at Lyndon McKinley High School. He's a student ambassador, and we're so proud of him. And he is here to do the Pledge of Allegiance. So I'll turn it over to you as we do the pledge.
All right. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you so much. We have a full agenda this evening. We will actually begin, board members, with a presentation from our about health. We have both our internal staff and the Columbus Public Health team who is here to talk with us. We do have public comment for the evening. We will then do an executive session. We have public hearing on reemployment of retired employees and a notice of public hearing on a reemployment of a public employee. Superintendent has a report. The internal auditor has a report. Treasurer does not have a report, but maybe he has something to share with us. I don't know. We'll ask him. And then we have, of course, our we have board matters. We'll be looking at a first reading of omnibus amendment, and we'll turn to Board Member Brown on that. And then we have our consent agenda, and we will conclude with announcements and adjournment this evening. That is our agenda. Is there a motion to approve the agenda?
All right, motion to approve our agenda.
Second.
Thank you. Please call the roll.
President Adair,
Yes.
Ms. Beckerly,
Yes.
Mr. Brown,
Yes.
Mr. Cole,
Yes.
Dr. Pierce,
Yes.
Mr. Ragland,
Yes.
Vice President Reyes.
Yes.
That motion carried.
Thank you so much. We will now go ahead into board presentations. We will hear the health presentation from our team, as well as Columbus Health. I will turn it over to the superintendent to go ahead and intro this presentation.
Thank you, President Adair. As everyone knows, my administration is all hands on deck, working diligently to finalize the details and the logistics of our return to in-person blended learning plans. Since we have made the decision to return to blended learning, I, of course, have been asked many times about the detail of the full plan. And I know that board members, you too have been asked these questions. One of the many, many difficult circumstances we find ourselves in as a result of the ongoing COVID pandemic, as it relates to operating the largest public school district in Ohio, is information and factors impacting decisions change rapidly. They change from month to month, week to week, and even day to day. As a result, and this is the challenging part, we all have to function and operate with a strong commitment to patience and flexibility. That includes both in our professional lives as providers of education for 50,000 students, and also in our personal lives as parents and families doing their best to navigate their children's education during an ongoing pandemic. I will be the first to say it is not always easy. On some days, the challenges can feel insurmountable. However, I do continue to have great faith and belief in our students and their families, that they can meet these challenges, especially if CCS continues to provide ongoing support. I have great admiration and belief in our teachers that they are rising up to the occasion to provide the best education possible, just as they're doing now in a fully remote setting, and as I know they will do in the blended learning model. And I have great respect and faith that our staff, including bus drivers, food service workers, nurses, secretaries, and custodians, are committed partners to serving our students and providing a safe environment for our students and staff. And last but not least, I have faith in the tremendous work underway by my cabinet and management team that is working nonstop to provide the best and most effective plan for our students to return to the building safely and effectively under the parameters of state and local mandates, transportation requirements, health directives, and guidance. When I'm asked, Dr. Dixon, please provide us with the details of the plan, I am not able to provide the answers that they may want at this time. It is important for me to take a minute, as I do when I'm asked this question on Zoom or in an email or on the phone, to discuss the many, many factors involved to returning in a hybrid manner for 50,000 children. Breakfast and lunch is a critical issue. Not that we will provide free, nutritious meals, but how we provide them. We are working through the ODE and CPH guidelines for children to be provided the food safely and to then eat their breakfast and lunch safely, socially distanced from one another with supervision. And we are developing plans to provide those meals for the 3 days that students will work remotely from home after their 2 days in person. There are many, many details and logistics. We're also working with our excellent community partners who help provide services not only during the school day for many of our students, but also critical, important services before the school day and after the school day, such as latchkey, tutoring, after-school meals and snacks, preparation for taking the SATs, ACTs, and college applications, just to name a few. These organizations, like CCS, are restricted in their program delivery by the need to implement social distancing. We are working with these groups to coordinate and develop plans and programming for our students that meet federal, state, and local requirements. There are many, many details and logistics. As many of you know, because blended learning results in changes to the workday and conditions of parts of our employment contracts with our labor partners, we must negotiate with our labor partners. And these agreements about blended learning. We appreciate the opportunities for these discussions and the input from our labor partners in our planning, as we will always have critical discussions that result in the best conditions for our teachers and our staff and the best education delivery for our students. We are underway with these negotiation sessions with the labor leaders representing our teachers. In fact, there was a session yesterday and again this afternoon. Our team is meeting tomorrow morning with labor leaders representing our bus drivers, food service workers, and custodians. There are many, many details and logistics. Another huge factor that impacts our finalizing plans is transportation. As most everyone knows, not only do we transport our CCS students, but we are also required by law to route transportation for some 13,000 charter and non-public school children. In many, if not the majority of those cases, these are smaller schools in terms of the number of students when compared to our 50,000 students. Why that is important is that means many of these charter and non-public schools are returning 5 days a week as they are able to social distance smaller student populations in their buildings. That requires a tremendous complicated bus routing schedule with many, many details and logistics. These are just a few of the many factors that must be planned and impact our decision-making, and finalizing the blended learning plan. It is important for parents, families, and all staff to have a brief understanding of our process and why we may not have received why you may not receive information as soon as you would like. But let me say this loud and clear. I and this board are committed to providing detailed communications to families, teachers, staff, and our community partners when the plan is finalized and we have all the I's dotted and T's crossed. I am committed to detailed and frequent communications as we indicated last week. This information will include information about students and parents' orientation, about how the school building will be physically set up and how they will operate with the new health and safety protocols. The detailed communications would include what the school day will look like for a student in various grade levels, how they would interact with their teacher, and eat breakfast and lunch. The communication will provide, of course, transportation plans, not only routes and pickup and drop-off times, but the new COVID health and safety protocols that must be followed on the bus. I know and understand that we do not always provide information to our families as quickly as they would like. I understand that that can be quite frustrating, but I ask for understanding from our families while at the same time as I make the commitment along with the Board of Education that when our blended learning plan is finalized, we will provide frequent and detailed communications and updates. We will continue to also provide information via our virtual community engagement sessions for parents and families. And we will continue to provide ways for families to ask questions and seek assistance. Finally, I can also say this evening with certainty that CCS, with the help from our teachers, staff, board, and community partners, will continue to provide and deliver the best possible academic plan for our students while doing all we can to help them safe, to help keep them safe and healthy under the guise of an ongoing pandemic. As the CCS community hears me say frequently, the health and safety of our students and their families and all of our employees and the greater community now more than ever is our top priority. To that end, this evening we have invited Columbus Public Health to join our meeting to discuss the status of COVID-19 and the infection rate within our attendance boundaries. I believe it's important that we all understand this information to help understand this factor that impacted our decision to return to the buildings with blended learning. And also to hear all the protocols being implemented to prepare for our return, including everyone wearing masks, social distancing steps, and physical changes to building and classroom space, such as the installation of plexiglass dividers and the setup of desks in the classroom. Tonight, we will hear from Columbus Public Health Commissioner, Dr. Mashika Roberts, and the Director of Public Health Policy, Edward Johnson, as well as our own Director of Health, Family, and Community Services, Dr. Kate King. So I'd like to introduce and turn it over to Dr. Roberts and Mr. Johnson.
Well, thank you and good evening. Can you all hear me? Great. Good evening. I appreciate the invitation to be able to join you. And just as it is a priority for you to keep your students as well as your staff safe, it's definitely a priority for us at Columbus Public Health. I want to share a little bit of numbers with all of you in terms of where we are with COVID-19. So if we can share my slides, that would be great. And let's take you to the first slide, which just talks about our numbers. This is a report that we post on our website every day. You can go to columbus.gov/coronavirus and find this report as well as other reports that we publish throughout the week. This pandemic started in Columbus March 13th of this year. That's when Columbus had its first case. Since that time in the city of Columbus, we've had over 22,000 cases of COVID-19. And if you look on your far right, you can see the number of cases we've had in the county. It's obvious that the cases in Columbus take up the majority of the cases for the county. Unfortunately, we've had 483 people who have lost their lives due to COVID-19. And we've had almost 2,000 that have been hospitalized as a result of COVID-19. Early on in this pandemic, we saw a good proportion of our cases were healthcare workers. At one point, we saw about 20% of our cases were healthcare workers. That number has significantly decreased now to 9%. And in terms of our age range, our cases have ranged from the age of 0 or just a few months old to 104 years of age. Next slide. So this just breaks it down. You can see from a gender standpoint, we have almost 50-50 male and female. You can see the hospitalization rates there with only 7% of our cases needing hospitalization. Of those who required hospitalization, a very small percentage, about 16%, actually needed the ICU. And then again, you see the healthcare workers there. The next slide is going to help us break down the race ethnicity breakdown, which we know as we talk about health disparities, we know that this pandemic has really put the spotlight on health disparities, not only here, but across the nation. So African Americans in Columbus make up about 29% of the population. Yet we make up 26% of the cases of COVID-19. But really what's most concerning is when it comes to complications, we make up 40% of those that require hospitalization. And if you look at Black and Brown, so not only non-Hispanic Blacks, but Hispanics and Asians and others, you see that we make up a large percentage, almost 70% of those that require hospitalization. A lot of this has to do with our health disparities. Black and Brown people are more likely to have diabetes, more likely to have lung disease and heart disease that predispose them to the complications of COVID, not the infection itself, but the complications of COVID. So go on to the next slide. So this will be important for all of you, especially as we think about K through 12. But when we look at the majority of our cases, where are they coming from? The vast majority of our cases are between the ages of 20 and 29. You can see in that blue bar, they really stand out. That being said, the second age group is 30 to 39. And then the third age group is that 0 to 19, where many of our kids in K through 12 will fall. They make up 3,570 of our cases. But I also want to show you another trend that you're going to see in the next few slides. We'll go on to the next slide. But you can see when we break down the ages from 0 to 23, from the beginning of this pandemic in March until now. And I really want you to pay attention to the lines for the dark blue and the light blue, which are at the bottom of this graph. That age group really makes up a very small percentage of our under 19 or under 23. The vast majority of our cases under 23 years of age are really between 17 to 22 years of age. So that could be your high school students, but what we see and why you see that spike in late August, that was OSU returning to campus and starting to test all of their students, especially those living on campus. And then the orange line, which is the highest line on here, is those who are 23 and over. And that's where we've seen the vast majority of our cases. So again, if we look at students or kids under the age of 16, we've seen very few cases in that age group, but that's not to say we're not seeing cases. We've seen very few. The next slide will also show you kind of the trend of when we started seeing those cases. So if you look March through June, this was the majority of the time when schools were let out. We had stay-at-home orders, very few businesses were open. And you can see in that time period, we only had 888 cases that were between the ages of 0 and 19. And then if you look at July and August, when things start to open up a little more, we had some summer camps, we had some extracurricular activities, not necessarily related to schools, but our youth were getting engaged in other activities. That number doubled in just 2 months. That number went from 888 cases over a 4-month span to 2,000 cases in just the month of July and August. And then when you look at our cases in September, again, this is a time when some school districts were going back to school, some private schools were opening. We were definitely seeing some trainings for football and soccer and other sports. In the month of September, our cases were over 1,600. And then below that, you can see the geography of where these cases were located. So clearly in March through June, you see more dark spots in the inner core of Columbus. But then when we got to the summer, we saw some of those dark areas, which is where we had more cases, more on the outskirts of Columbus, the surrounding area of Columbus City proper. And now when we look at September, we see that dark spot again, more in the core of the city. Again, just to emphasize where the geography of our cases are. And again, this information is on our website. I'll go on to the next slide. This is all cases, not just our 0 to 19. So all cases in Columbus by zip code. And so on your left, you see cases by zip code, and these are just raw cases, number of cases by zip code. And then on your right, you see rate by zip code. So taking into the population of that zip code and the number of cases in that zip code. But really what you see again is that inner core of the cities where we see a large number or a lot of dark trend colors there. So whether it's dark blue or the dark red or orange. And I'll go on to the next slide. When we look at our cases, again, throughout the life of this pandemic here in Columbus from March until today, you see what you should see are a few things. One, I want you to pay attention to the red line. The red line is our trend line. But then I want you to pay attention to the blue bars, and you'll probably see kind of some hills and some valleys. And we call the hills our peaks, and then we call the valleys our lows. So you saw that back in April, early May is when we had a peak. Now keep in mind that peak was, we tried to flatten the curve, as Dr. Acton used to say. And I think we did a really good job, but we also were mostly at home during that time. There was very little activity, very little movement around, but we did a good job of flattening the curve. And then in late May, we started opening the state back up, opening the city back up. And then around mid-June, we started to see our cases go up again, and we peaked right after the 4th of July. Right around that time is when we put a mask order in place in Columbus, and then that later became a statewide mask order. And then we saw a nice decrease in cases. By early August, we saw a nice decrease in cases. And as a result of that, I was able to announce we had met that goal of 4 consecutive weeks of a downward trend in cases. And then we started going up again, and we can attribute some of this to OSU coming back to campus and them doing serial testing on many of their students. But we also have to attribute this to some of the activities that were happening around us. More activities were allowed, more socialization was allowed. And so we saw that bump in cases as well. And now we have again seen 4 consecutive weeks of a downward trend in cases. I really feel good about where we are now in terms of our case count, not only our case count, but most importantly, our positivity rate. And we want to keep that going. So this next trend just shows you what our 28-day linear trend is. And the red line here is really the 14-day trend line. And you see it's a steep curve on the way down. And we always want to see, when we're looking at cases, a downward trend in cases like that. So again, just more evidence that we're moving in the right direction. And it's a good time for our kids to go back to school. So let's talk a little bit about what the state has done to help us gauge not only where we are in terms of disease activity, but where the rest of the state is for disease activity. So several months ago, the state came out with their Ohio Public Health Advisory System, which was a COVID-19 risk level. When this was first introduced, Franklin County was one of the first counties to be level 3 or red. What was concerning is we were also on the watch list at that very same time to be a level 4 or purple. This came out, I believe, late July, if I'm not mistaken. And so it was really concerning for me, especially as we knew so many districts like your own were thinking about and preparing to go back to school. So this really concerned me. And I thought, this is a good time. We all need to take a pause and really see what's going on. We stayed at level 3 for a while. We never made it to level 4. No county in Ohio has ever made it to level 4 as of yet, and that's a good thing. We have now been at level 2 or orange for several weeks. I think it's been close to a month now, 4 consecutive weeks we've been at orange or level 2. And I'm optimistic that we're going to stay that way. I'm also optimistic that in the near future, we could go to level 1. But we all have to be careful, because even if we go to level 1, like before flu season really peaks, flu season could easily make us go right back to level 2 or even level 3. So we just have to proceed with caution if we were to become a level 1 county. So the next slide is something that, we've been working with your school district as well as many other schools about how to handle a sick child or really even a sick employee. And so this is an algorithm that we've developed about what to do if you're symptomatic. That's on your right side. And this is something that you all should be very familiar with. The signs and symptoms of COVID can mimic a lot of other diseases. And so we have to be really mindful of that. And so what I always tell my staff is, if you have a symptom that you've never had before, if you have a headache and you're not known to have headaches or migraines, that should be a red flag for you to stay home. And at least stay home for 24 hours. Wait to see if it gets worse. Wait to see if any other symptoms develop. And if not, if it gets worse or other symptoms develop, you should contact your healthcare provider. But most importantly, especially if you want to get back to work or school, you should get a COVID-19 test. We're fortunate here in Columbus that COVID-19 testing is readily available. All you have to do is call 645-1519. That is our COVID-19 number that takes you directly to Columbus Public Health. We can answer a lot of questions for you about COVID-19, but we can also guide you and direct you of where you can get tested, whether you have insurance or not. We are still doing testing at Columbus Public Health in our front circle 5 days a week in partnership with our 3 adult hospital systems. And even though I say our adult hospital systems, we also test children at Columbus Public Health. So that takes you that way. If you have symptoms, if you get tested for COVID-19, obviously, if you're positive, you need to isolate for at least 10 days from the date of your initial symptoms. If you're negative, you need to see what other diseases you might have, whether it's the flu, whether it's strep throat or something else. So we encourage you to get evaluated, and it just walks you through that. I think what's most important is what happens on the other side. If you've been in close contact with someone who's been diagnosed with COVID-19. And at this point in time, close contact is described as less than 6 feet for more than 15 minutes. Whether or not you have a mask on, it doesn't matter. As long as you're within 6 feet and for more than 15 minutes, you are counted as a contact. And that person who is a contact has to be quarantined for 14 days from the time of last exposure to that symptomatic person. And if you develop symptoms, then you should get tested. But even if you get tested and you test negative, it still doesn't mean that you can be excused from quarantine. You have to be quarantined for 14 days. Now, this could be significant when kids go back into the classroom. And so that's why we really encourage everyone, even the teachers, to keep their 6 feet of spacing from students. And if you have to be closer than 6 feet, make sure it's for a very short period of time. not more than 15 minutes, because then you could cause yourself to have to quarantine more people than you had anticipated. And I know that has been a challenge for some schools across the state and really here in Columbus. They've been surprised of how many people need to be quarantined. But again, you need to watch your space, wear the mask, and watch for symptoms and wash your hands. So let's go to the next slide. I think I might have one more slide. This just shows you what it looks like on our website. Again, if you go to columbus.gov/coronavirus, we have resources here for COVID-19. We break it down, whether you're a school, whether you're a community member, whether you're a healthcare provider, whether you're a religious institution. We have facts and we have guidance. So I strongly encourage you to check out our website for information. And all of these documents have also been shared for the schools, have also been shared with Columbus City Schools and Kate King and her team. So I am happy to answer any questions. These are just reminders of all the things we tell you about COVID-19, as well as all other respiratory viruses. Wash your hands often with soap and water for 20 seconds. Make sure you cover your cough and sneeze. Avoid close contact with people who are sick. Stay home if you are sick. Avoid touching your eyes, nose, and mouth with your hands. Clean and disinfect your objects and surfaces frequently. And most importantly, wear a mask.
Thank you so much, Dr. Roberts. And we know you have a hard stop today at 6:20. So we're going to actually pause to ask some questions and then move on to the rest of the presentation. So we will start with Board Member Ragland and then with Board Member Beckerly.
Thank you, Dr. Roberts, and to the rest of your team for all of your work and leadership throughout this entire pandemic. I want to really make sure that I shout out Mr. Ed Johnson for conducting all of the calls that he has had with our elected officials and our contingency there, and giving us and keeping us informed of what is happening. You said within your presentation that you felt that it was the right time to start bringing students back into the buildings. I would like some clarity on that, but just please answer this. Is it safe? And the reason I'm asking that very direct question is because saying that it's the right time really provides some wiggle room for those who are adamantly opposed to any type of in-person learning. And I want to know unequivocally from your professional opinion, and you are the lead expert in this area in Franklin County, is it safe for us to begin bringing students and staff back into our buildings?
So that's a great question. And I would say that knowing all the precautions that have been put in place by the state and knowing all the work that Columbus City School has done to protect the students and staff, I would say it is as safe as it can be. Now, every time we walk out of our house, I go to my office every single day. Every time I walk out of my house, I am potentially exposing myself. If you go to the grocery store, you're exposing yourself. If you go to the CVS or any, pharmacy, you potentially are exposing yourself. So I would say that knowing that and knowing that we're going to have smaller classrooms, everyone's going to be wearing a mask, we're going to be keeping our space, that I think it is safe for us to go back to school, just as safe as it is for us to go to the grocery store, for us to go shopping, and for us to go out to eat. So given where we are in this pandemic, yes, it is safe. When I look at our schools that are already operational and already have kids in the classroom, the number of cases we've seen have been relatively low, definitely relatively low. So again, if all the precautions are followed, then it is safe as it can be for our kids to go back into the classroom.
Thank you very much, Dr. Roberts. Thank you, Madam President.
Thank you, Board Member Ragland. Thank you, Dr. Roberts. We'll turn it to Board Member Beckerly.
Okay, thank you. I too want to give a shout out to Edward Johnson. He has been intrepid in delivering the data to us 3 times a week, and it's really appreciated. A couple of things. One is I think it would be really helpful, and it kind of hit me, I finally understood. And I've been getting a lot of emails from parents and concerned community members about what it means to be 4 weeks in the declining. Because we look at that, daily,
Epi curve.
yeah.
Epi curve. Mhm.
And to us, it's going like this, you know? I mean, granted, you can see there's an overall decline, but then you showed that straight line thing. So I think maybe just like a few seconds on what you mean by like in the world of science, little fluctuations don't count. It's that longer term thing would be helpful to people, because I think, and even I know I tend to do it. If it goes up one day, I'm like, oh, there we go. We're not declining anymore. So maybe just a few seconds to explain that would be really helpful to our families and our teachers and our staff.
Sure, I'd be happy to. So yeah, yes, there can be some minor fluctuations from day to day, and that's what you're seeing. Like they look like jagged lines,
Right.
But we want to look at that trend, and so the trend is kind of what's the norm. And so if we go up by 5 cases one day and down by 10 the next day, what my epidemiologists do is they kind of look at the median. They look at the what's really the average. And so what I can tell you, and I was actually looking for the numbers in front of me, here they are. So the week of September 6th through the 12th, we went down by 9 percentage points, our case count. Then the next week we went down by 20%. And then the next week we went down by almost 30%. And then this last week, September 27th through October 3rd, we went down by 8%. So for the last 4 consecutive weeks, we've had a downward trend in cases.
And so even though within that week, there might be an up and a down and an up and a down, that doesn't matter.
Correct.
In terms of your comfort level. All right. So I think that's important for us to all understand. And then the second thing, and I've kind of tortured Edward with this a little bit too. How can you give us some sense of how to, I don't know, balance or take into account both that overall trend and the fact that, that's a really good factor, and what we see as infection rates in a lot of our zip codes, which, because if you look at the infection rates, I could get really panicked and saying, well, they're almost double, especially if you look at hospitalizations, what it is in surrounding areas in some of the zip codes. But when the overall cases are at 70, so if there's any sense you could give us about how to not panic over the one, given the others in such good
yeah, so that's
trend.
That's a tough one. I mean, keep in mind, like, although some of your zip codes might have a darker shade, so to speak, so they have more cases, when I'm looking at the overall cases, it's everyone in the community. And so I wouldn't, I think we could be doing our communities a disservice if we said, look at the cases in our zip codes and why their shades are darker, and as a result of that, our kids shouldn't go back to school. That's not fair for your students. That's not fair for your staff, because the cases, although there might be more concentration, there's probably also slightly smaller population in that area. So that's why we do it not only by cases, but by rates. But I think, when we look at individuals don't stay in their zip code. I mean, how often when you leave your house do you go to a different zip code? So I think we just need to be mindful of that. That's one data point we look at, but we shouldn't make solid decisions on that data point alone.
Thank you. Thank you very much.
Thank you. Up next, Dr. Pierce.
Thank you so much, President Adair. Dr. Roberts, I have 2 very quick but probably detailed questions for you. The first question is really for all of our parents out there that have been following along on the CDC's indicators for dramatic school decision making. This is a particular tool that gives high risk, moderate risk, low risk for various zip codes and areas. Can you speak to how that data has informed the recommendations that you are giving to our superintendent and our district to return to school?
So that data, if I'm not mistaken, because Ohio has not completely adopted that data. And so just keep, or that guidance, I should say. But if I'm not mistaken, it looks at case rates, it looks at hospitalizations, and it looks at positivity rates. So I can tell you that when I look at our numbers here locally, again, our case rate is going down. That's that 4 consecutive weeks of trend, or that straight red line you see, the 14-day downward trend. I can also tell you, I just shared about how our cases had dropped anywhere from 8% to 20% over the last 4 weeks. Our hospitalization rates are very low. Our hospitals have a lot of capacity to take sick kids, or sick people, I should say. In addition to that, another factor that we all look at is our positivity rate. And, the ideal goal is to get you down to a positive, not get you, but get us down to a positivity rate of 1% or less. And that's ideal. We've never been at 1%. And I'm not too optimistic that we will get to 1% until we have an effective vaccine that people are actually getting. Right now, our positivity rate is ranging anywhere from 3.5% to 4.5%, which is good. I mean, if you can get a positivity rate below 5%, you're doing pretty good. So I think based on those factors, again, not having that CDC report in front of me, we met many of the criteria that CDC would want us to meet.
Thank you for that. And then my final question is, we've received a lot of emails, as my colleagues have shared, and one of the concerns that our community has is we're going back at the height of flu season. So can you speak to how some of the precautions, the guidelines that you're recommending will help us to mitigate or decrease the flu in some respects, if it does? And I'm assuming that some of those guidelines will help us do it.
Absolutely. Every single one of the guidelines for COVID-19 will help reduce the spread of all respiratory viruses. So not just COVID-19, but flu and, RSV and everything else that circulates in the winter months. But one thing that I would strongly encourage your staff to do, as well as your parents and students, is get the flu vaccine. I know this year it's going to be tough. Usually Columbus Public Health comes into Columbus City Schools and provides the flu vaccine to your students every single year. This year, we're not going to be able to do that for a variety of reasons, as you can imagine. But we're making the flu vaccine available starting this Saturday. We're having a drive-through flu clinic at Columbus Public Health every Saturday in October. Next week, we'll be at Columbus Scioto High School, I believe. And then the week after that, we'll be at Briggs High School. Again, drive-through. No one has to come indoors if they don't feel comfortable being in an inside environment. And we're providing that flu vaccine for everyone who wants it and everyone who needs it. So I really would encourage you to get the flu shot, the flu vaccine, as soon as possible. But, flu usually peaks sometime in November through March. And so we've got a few months to get the kids back in school, get them vaccinated before we see that peak of flu season. And we don't know what flu season will be like here. And some of our Southern Hemisphere partners have seen a decrease in flu activity in their countries, largely due to wearing masks. And so we want people to get vaccinated. We want people to wear the mask, and we're hoping that we'll see that same trend happening in the United States.
Thank you so much. I appreciate that. And just given that you have introduced the vaccine clinics, do we need to bring any documentation? Do we need to bring proof of insurance? What are the guidelines for even coming and showing up to get that flu shot?
An ID would be helpful. And if you have insurance, you can bring your insurance card, but we will not turn anyone away for inability to pay.
Thank you so much. We appreciate that.
Thank you.
You're welcome.
Dr. Pierce. And our final question then for Dr. Roberts will be from Board Member Brown.
Thank you. Dr. Roberts, good evening. Thank you for joining us, and thank you for all the good advice that you've given to Columbus City Schools and the public over time. I, for various reasons, including my wife's job, tend to listen almost daily to Joe Mazzola and his report. And I also read CDC reports and some of the other national information. One of the things I hear about from parents, and I read about a great deal is ventilation. And that's probably not entirely in your bailiwick, but it's one of the factors that I am hearing about more and more and is being raised by our parents a great deal. So the question is, what's the significance of ventilation in the mix of all of this?
That's a great question. And we're learning as we go. And as you may or may not know, CDC just came out with new guidance yesterday about whether COVID-19 is airborne. And previously they had said it was airborne, then they said it wasn't, or they took the document down, and now it's back up. And we know ventilation is important. We've heard that from national experts talk about ventilation. That's why we know outdoors is better than indoors. And so there's some clear guidance on CDC's guidelines on their webpage of what you can do to improve ventilation in indoor settings. And so I would refer you back to some of those guidelines. My sanitarians would be happy if there were specific areas that you wanted to look at, that you were concerned about ventilation. We could come look at and provide some guidance. But when I say we, I really mean the public health community is learning as we go about what's the best way to improve ventilation in a building, whether it's a school or any other facility at this time.
No, thank you. I appreciate that.
You're welcome.
Thank you. And thank you, Dr. Roberts. Thank you, Edward. We very much appreciate your partnership and all the guidance that you have given us in our decision-making on how we move forward. Madam Superintendent, is there anything you needed to close with Dr. Roberts?
No, again, thank you, Dr. Roberts.
Welcome.
Great information, and board, great, excellent questions for follow-up. Thank you.
Thank you.
Thanks.
And I now believe Dr. Dixon will go back to Kate King.
Yes.
For the rest. Yeah. Hi, there she is.
Up next, yes.
Hi. Thank you so much for having me. And I just again want to thank Dr. Roberts and the Columbus Public Health team. We work together very closely. We get great support from them, and we meet every week, if not more than every week, to talk about that. So today I'm just going to talk about our COVID-19 surveillance and tracking and how we're looking at that data and what we're doing in conjunction with Columbus Public Health in our safety plan. So I did also provide this slide that Dr. Roberts went through very fully. All of our school nurses have this slide, as well as our building administrators and non-school building supervisors. And we are continually updating and educating on that. But since she went over it in such detail, I don't need to go over that. What I do want to talk about is what's happening when we do get reports of either positive cases, positive exposures, or symptoms when students or staff are at school. And here is a screenshot of our Google COVID-19 tracking form for Columbus City Schools. And what we are doing, and we've been doing for about a month now, is rather than using a paper pencil form and having all those papers throughout schools, we have developed a Google form for entry of any of those symptoms, of exposures, or positive cases. And the beauty of this tracking form is that it automatically populates our data into a Google Sheet, like an Excel spreadsheet. So what we are looking at again is we're collecting data. We're putting it on the Google form, and in our buildings, school nurses can do that, as well as other staff members who receive calls from parents or other staff members, and building administrators, and those persons will have access to put this data on the Google form, which of course, as I said, then populates on the Google Sheet. A school nurse is assigned to each building, each school building, and each non-school building, and they are looking at the data from this Google Sheet every day. They're looking at it for a couple of things. The first thing they're looking for is positive cases. So when the school nurse reviews this data every time they see a positive case, many times they've put that positive case on the Google form themselves, they report those positive cases to Columbus Public Health. There's an online reporting form. It's very simple and easy to do. And the school nurse then puts those cases on to the Columbus Public Health site. We also then, with positive cases, do internal contact tracing. So anytime there's a positive case that is reported to us and we report to Columbus Public Health, or if it's the other way around, which sometimes happens, we hear from Columbus Public Health that we have a staff member or a student with a positive case, we conduct internal contact tracing. What does that mean? Well, remember how Dr. Roberts talked about being within 6 feet of someone for 15 minutes or more. We are looking for that contact. And if and when we do find that contact, we will inform that staff member or parents of students that they have a possible exposure. And that's when the 14-day quarantine comes in. Now, what we're going to do is when we have a positive exposure, besides notification, we send that student, and we haven't sent students home now because we're not in in-person learning yet, but we have sent staff members home for that exposure contact. And then Columbus Public Health works with us to determine if there actually was a significant exposure. Most of the time there is. We take that data then and we relate that data to the Columbus City Schools dashboard. The dashboard is a gauge for anyone in our community, parents, staff members, community members, to see how many cases within a week we have that are related to in-person learning. Here is a screenshot of our COVID-19 data dashboard. So we are updating it every Thursday. The state updates their school dashboard every Thursday. We think that's a good idea that we're all updating our dashboards at the same time. So we give you the approximate number of Columbus City School staff members. We give you the approximate number of Columbus City School students, and then positive COVID-19 cases reported to the district and associated with in-person learning and activities. And we use that in-person learning or activities because that is really where we are concentrating our efforts for possible exposure. If we hear about a positive case of a staff member or student who's not been to school at all, who is not back in learning or not back in person to a building, we don't report that because that person has never entered our school building and has no chance of transmitting that virus within our school building setting. So that's where you will see a weekly update of those cases reported to the district and associated with in-person learning. Just want to go over the symptoms again. This is from the CDC. Remember to stay home and to keep your children home if they have fever or chills, a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, a sore throat, congestion or runny nose, nausea or vomiting, or diarrhea. It's that long list, but the important thing is that if a staff member or a student has any of those symptoms, stay home. Stay home and see, as Dr. Roberts so eloquently explained, that see if it goes away in 24 hours. That way, you're just keeping a good eye on what is happening, and we're not exposing anyone not only to what could possibly be COVID-19 symptoms, but any other illness. We really want to keep our illness rates down for any illness, even the common cold this school year. I want to talk a little bit about the separation room. The separation room is a room in every building, not just our school buildings, but every building will have a separation room. Sometimes it's called an isolation room. We're calling it a separation room to distinguish it from other isolation room criteria and procedures. So the school will have that room. Anyone who exhibits COVID-19 symptoms during the school day, that fit in line with the algorithm that Dr. Roberts and I both shared will be given a surgical mask and escorted to this separation room until they can leave the building. Now, for most of our staff or our agency partners, that adult person will just leave the building right then and go home. For our students, we are asking that parents pick up their student within 30 minutes. So we're going to look at a cell phone. That cell phone, we're going to notify you right away. So it's very important to have up-to-date contact information for you, for your student. It's always important for those emergency cards to be filled out, but it's never more important than right now. So if your student exhibits symptoms of COVID, we'll be notifying you. Then we're going to ask the car that you come to the school in 30 minutes to pick up your child. If you can't do that, we really would like you to have several backup plans, several backup people who could come and get your child. I know that it's difficult for many families, and as soon as we get back to school, it's time that parents can go back to work. And it's really hard to take off of work again when you've just started back to work, or you don't get sick leave from your job, or you work far away from the school. Again, so important to have some backup plans to come and get your child as soon as possible. I think that when children have symptoms and they're going to be a little bit scared, and we're going to do our best to comfort them and make sure that they feel safe. However, the best thing for them is to be with their parents. Again, we'll give you a call. We'd like you to come within 30 minutes and get your child, or have a plan to get your child, have someone else come and get them. So what is the school nurse doing during this whole time? School nurses, as you can see in the media, are so important in this back to school process. More important, or at least we're seen as more important than ever before. We're going to be doing all the things that we normally do, making sure your children have the medication and their documentation, making sure that we take care of acute and chronic illnesses and injuries, linking students with healthcare providers, making sure that we have health plans in place for them. But in this time of COVID, we are going to heighten our focus on communicating and collaborating with Columbus Public Health. Dr. Roberts has talked about that, and I've talked about that again and again. We are communicating and collaborating with them. Your school nurses right now are developing building level health plans. So what happens? We do know what will happen when somebody exhibits COVID symptoms in school, or when we have a positive case, or when we have a positive exposure. But the nurse is, again, in the buildings developing those plans to make sure that everyone in the building knows the specific plan for that school. Again, school nurses are going to determine symptoms, possible exposure, or transmission to other students or staff. We will be certainly on point and transparent about any time you need to be notified that your child was exposed to someone who has a positive case, needs to be quarantined, or has a symptom. Again, we're going to notify parents and guardians and staff of possible exposure and provide directions for those next steps. We have letters, we have texts and emails, and of course, the best is when we can talk with you about what's going on. Right now, we're developing a dedicated phone line for parents and guardians to talk with our schools about COVID-19, especially for reporting positive cases. It's so important that we know about those immediately so we can help you get the care you need. Those are the things that the school nurse is going to do. Also, school nurses are working very hard on immunization status. I would be remiss in not telling all parents who are listening that we really need for you to contact your healthcare provider and get your children's immunizations up to date. We have 11 schools with school-based health centers staffed by Nationwide Children's Hospital. The Nationwide Children's Hospital mobile unit has been going from school to school, and Columbus Public Health's immunization clinic is open by appointment. School nurses will be calling you, emailing you, texting you, trying to find a way to help you get the immunizations your child needs, and especially our flu shots. So important these days. Again, I wish everyone a safe and healthy return to school. We are working very hard in the Health, Family, and Community Services Department to provide all the necessary processes, procedures, forms, and information so that not only can people come back to school safely, but we can keep them in school safely. Thank you so much, and I'd be happy to answer any questions.
Thank you so much. Yes, we do have some questions. We will start with Dr. Pierce.
Thank you so much, President Adair. Dr. King, I'm going to pick up right where you left off with the immunizations. One of the challenges that I hear from our families is that when they bring their students to the immunization clinic, if they don't know where their child is on their immunizations, they're unable to get immunizations. So my request is, are we going to provide the immunization records to families so they have that starting point?
Thank you, Dr. Pierce. Yes, we always, when we refer students to immunization clinics, provide parents with the immunization record that we have on file. Right now, we can email that to parents so that they can even have it on their phone to show in immunization clinics. You know, we've changed a bit. We used to always have to have that hard copy paper, but we don't. Immunization clinics are taking pictures of those. With parent permission, we could send those right to the clinic if we can do that. And we would be happy to do that, email those records right to the clinic.
So again, you just said for the students that you refer, my request is that all students, all families are just given that information. So it's not a matter of us referring certain students.
Can you clarify, like
So
all 50,000 students get their immunization records?
The child that you don't refer, but they show up at a clinic and they don't have that immunization record. I'm saying, can we be proactive and supply all of our families with what we currently have to say, here's what we have on file right now, so they can go to the clinics as they see fit or can make it available to go.
Well, Dr. Pierce, certainly I will look with Dr. Klein in data and Greg Wisniewski on how we could get all of that out to all of our parents. Certainly, I know we could access our parent portal and use that. So let me work on a way that we could do that en masse.
I appreciate that. And then my last question is this. We have a number of parents that are concerned that if their child is showing one or two symptoms, so say you have a sore throat and a headache, but you've tested negative for COVID-19. Can you still send your child to school? Can that child still come to school?
So Dr. Pierce, thank you again. It depends on when that negative test happened. So the best way to do this is if your child is sick with anything, keep them home. Keep them home. If in fact their test correlates with after them having symptoms and they have been cleared by a healthcare provider, that the test adequately reflected a high enough viral load to be negative related to those symptoms, we can do that. It's a little complicated in that, for example, if I'm showing symptoms, I start my symptoms today and have a test, it might be negative. I might not have enough of a viral load yet for my test to be positive. We're going to work with individual families. We're going to take everything on an individual case-by-case basis. And again, try to link families to their healthcare providers and have that really good communication with everyone about what is happening and what we can do to help.
Thank you so much, Dr. King. I appreciate it.
Thank you.
Thank you. Up next is Board Member Brown.
Thank you. Good evening, and thanks again to you and all of our school nurses for the great work that you've done. I know your importance has always been true, but your visibility has really ramped up this last 6 months, and we appreciate all of that. Question that I have, and I had a conversation with a parent about this, and I guess I know it's true for me. What about the kids who are often and have for a long time displayed some of the symptoms, and yet it's attributable to other things. For example, I cough a lot. I clear my throat a lot. It's all post-cancer treatment. And yet, when I do that and I'm in a public place, I'll usually turn around quickly and try to explain or something. But you know, how are our kids who may typically have cough or typically have muscle aches? How are they going to be treated, and how is that going to work for all of them?
Well, thank you, Councilmember Brown. So again, we are going to take each thing individually. So I do know that you have a regular cough. I do know also that you might be asymptomatic, and the cough that you have is not related at all to COVID-19, but your cough is spreading and maybe aerosolizing viral droplets. So what we are going to do again is do that thorough assessment by a school nurse, determine whether or not this is something new. And if we determine that it's new or it hasn't been in evidence, say for several weeks or a month, we are going to refer those students and staff members to their physicians to determine if in fact that symptom is COVID or not. We do not have the ability to diagnose in schools, and you really need somebody to diagnose. Again, we've had several weeks where I've had 3 to 4 staff members say, you know what, I have allergies or I have sinus problems. I had one week where I had 3 staff members say that, and they went and got tested and they were all 3 positive. So we really are going to err on the side of caution when we deal with people, students, staff members with symptoms. We do not want to make anyone's life harder. We are here to, though, prevent transmission. And we want to make sure that anyone in school is not transmitting the virus.
I appreciate that. Thank you, Kate.
Thank you.
Thank you. We will now hear from Board Member Ragland.
Thank you, Madam President. Thank you, Dr. King, and for your team for all the work that they are always doing with our young people. My question concerns your comment about updated emergency contact information. Do we know the rate of return on our contact information for the district at this time? How many students have up-to-date contact information based on this particular school year? And how many have yet to return that information to us? Do you have that information available?
Board Member Ragland, I do not have that information, but I would imagine Dr. Klein does. So Dr. Klein and I are going to be talking a lot probably tomorrow, and I will see if she can get you that information.
No, and thank you for that. My reason being, you mentioned that we wanted to have extra emergency contacts on that list, and I don't know if we have provided the space literally on our contact information return forms for those extra contacts to be placed on those forms, and for students to return them with, maybe 4 or 5 emergency contacts this year. And I just wanted to know if this was an opportunity to work with maybe our IT department or someone else to, while we are still in this virtual environment, get that information out, double down on the fact that we really do need to have that information for those students who have yet to return it, and that we are asking for even more information for those students who may have already turned it in, but we'd like to have 2 or 3 more emergency contacts. That might be something that we can do while students are still meeting virtually, and that might increase our ability to do what we have to do once students return and we inevitably have some of the problems that we do. Also, it's a recommendation of mine that all of our information that we have submitted today, that you've presented to us as a board, and I don't know if you're doing this or not, but if we are, to use Dr. Pierce's word, proactive in getting that information out to our families using the apparatus that we have available to us, we want to try and get that information out to them weeks before the students are ready to come in, as much time before the students are ready to come in as possible, so that they're familiar with it, they're seeing it frequently. So it's almost like, when we send out a homework assignment, we're also sending this out every single day. And if there's a way that we can do that very easily to make sure the entire district is getting these notifications with all of this good information that has been shared, I would really appreciate that. But once again, thank you and your corps of nurses for all of the work that you all are doing to help us get ready and to help us continue to be safe within our buildings and within our city. I appreciate it.
Thank you.
Thank you, Board Member Ragland. We will now have Board Member Beckerly.
Okay, thanks. Ditto what everyone said. This was a great presentation. Really appreciate it. Where are we in terms of numbers of nurses in buildings? Do we have enough nurses to be in every building?
So we do have a nurse assigned to every building. We do not have a full-time nurse in every building every day. I believe we have now 65 buildings where we have a full-time nurse in the building every day.
Okay. Thank you. That was it.
Okay, I don't believe there's any more questions. I do want to echo the thanks to you and the full staff of our health department, the nurses and everyone else. Oh, is there one more question, Dr. Pierce?
Yes, there is one more question. Dr. King, I want to provide you with an opportunity. You just said we don't have nurses in all the buildings. Do you feel adequately prepared with resources when you think about your team to handle the task ahead?
So thank you, Dr. Pierce. I do feel adequately prepared. Would it be better if we had a full-time nurse in every building every day? Of course it would. Part of what school nurses do, and I don't think a lot of people understand this, is not always doing one-on-one care themselves, but creating the plan for that healthcare to be provided. I believe, and we've done this for many years, we have other staff in the buildings who can be trained to provide not assessments or evaluations, but to follow algorithms and very distinct plans for what we're supposed to do. The other thing that we do need to look at is that now more than ever, school nurses are able to access student information or even see students with the technology that we have. They're always available if they're in another building to, one, get a phone call, but we could do a Zoom meeting with a student. Shouldn't say a kid, with a student. We could, look at that in some different ways. So again, always available. And this COVID-19 crisis is terrible, but we've learned some great things and we can use that as well. I hope that answers your question.
It did. Thank you so much.
You're welcome.
Thank you so much. Madam Superintendent, is there anything left on this portion of the presentation?
Nope, that's the end of this portion of presentation. Thank you again to Dr. King and her team, and to, I'm not sure if Edward Johnson is still on, but thank you. Oh, he's gone. Okay. And again, board members, excellent questions that will hopefully bring clarity to many people who are listening. Thank you again.
Great, thank you. So we will move now into public comment. We have two individuals here to speak with us this evening. Each individual has 4 minutes to address the board. Let me pull up my timer here. Sorry, okay, now I'm ready. The first caller is Ella Coleman. The topic is information on Black History curriculum. The board action requested is she wants the Board of Education to approve the Black History curriculum for grades K through 12. Ms. Nichols, is Ms. Coleman on the line?
President Adair, she is on the line.
Thank you.
Yes, I am here. And good evening, to our superintendent and school board members. I'm so thankful to have the opportunity to share with you. I know you have a lot on your plate, so I am going to talk kind of fast because I know I only have just several minutes. Anyway, I am just shifting gears here, and I want to first of all just say that this curriculum proposal for Black history, I believe, is pretty essential at this time with the climate that we have, which I think I said that when I presented back in August. But let me just give you the purpose of this. The purpose of putting Black history into the city schools anyway, is to improve, correct, and balance the historical, cultural knowledge provided to students to promote their educational and life success. We're a diversified society, and no one really can be left out. And I think we're beginning to realize that. First of all, I'm going to move to needs assessment. We have a needs assessment just to show you that the need is there. Like many other schools, inner city schools across the nation, serving predominantly Black students, Black student population, there are certain things that are happening that is making the miseducation and the what we see in the streets, the violence and all of this. We have no cure-all for this, but we know that in little bits and pieces we can do things to help, and I believe that's what the curriculum change will do. I have a causes and effect. If you do have your handout, the causes, breakdown of the family, 70% single mother households, of course, there's lack of support, excessive responsibilities, economic disparity, destructive media, music, target Black kids, and of course, this causes into more discipline problems, Black men being excessively incarcerated. All of these are factors that we get the fallout of in the classroom. And so I believe that the classroom is a good place to start to initiate some changes. The miseducation comes through the predominantly Eurocentric curriculum, the mission of Afrocentric curriculum and other cultural groups and their histories, and predominantly white teachers teaching, mostly Black students and brown students. And there's nothing wrong with that, but there has to be some cultural specific things done and put in place to make sure that the learning styles of the Black students and the brown students too, and others, are not just one way. And so we want to do something to correct that cultural misunderstanding, that cultural gap that exists. Not enough teachers, there are not enough Black teachers, and this is something that I believe that we can do something about. And I have some things I've looked at, and I believe there are things that we can move ahead on in that. In this description, of course, we want to join forces, with people like myself who've been in the community, who's actually taught before, who is interested in, advancing education, to partner together. And that's what I'm hoping this will be. As far as the description of what these courses, what this curriculum would be, it would be based upon Black history that include African American history, as well as ancient and modern African history, and a K through 12 curriculum, starting from the very beginning, because that way we can eliminate a lot of problems on the back end if we get it up front, and should be interesting. We should use interesting teaching techniques, which consist of, and this is very important, if I don't.
When you are actually at time, but you do have some questions from board members, so maybe they can help get at what you were just about to get to. So I will turn it over to Dr. Pierce, who has a clarifying question.
Thank you so much for your proposal and presentation to the board this evening. This is, of course, as you might know, a subject that is near and dear to my heart, given my degrees from The Ohio State University in the African and African American Studies Department, as well as my teaching at Denison University. So thank you so much. As I read through your proposal.
Yes, I also went through that program.
Yes. As I read through your proposal, there was one question that just kept coming at me. I have a timeline, but I don't have a budget. In your proposal, you indicate that you want to hire culturally specific Black history teachers, do trainings. What's a budget for this curriculum estimated to be?
What I'm going to do, I didn't want to put figures out there before I actually had an in-depth kind of meeting and just throwing figures out there, because first of all, I need to make probably more of an assessment of, of course there'll have to be books, there'll have to be other things that's put in place, and I really need to probably speak with someone who is a part of the school system in order to get those figures. And so I didn't want to throw them off the top of my head like that, or just to assume, because every school system is different and each school system have a different budget. So I will be willing, though, to work with someone and just come up with what all of this would actually cost and itemize it. I'm not necessarily an accountant, but I ran a business, and so I've worked with accountants. And so I believe that would be the best way for me to do that, as far as itemizing the cost for the entire school system, getting all of the stats, everything in place, and being accurate. I'm a person that I'm an editor too, so I'm a person that likes to be accurate. And sometimes if I'm not accurate, I don't want to just throw stuff out there.
Okay, so I would greatly appreciate a budget to go with your proposal, even if it's just some rough estimates. If you want to pilot the program at a couple of our elementary schools, and that's how we start, or pilot it in a couple of our high schools, I think it would be valuable for us to have those figures. The next question I have for you then relates to the description of the curriculum. You said that it would incorporate some really innovative activities, learning objectives, I'm sure. So if there was one that you wanted to share with us, could you tell me what that one is and how it can align with maybe what we're doing right now, or why it's so critical and necessary because it does not align with what we're doing right now?
I think even if we still, we're dealing with COVID next year, beginning the 21 school year, I believe that the history documentaries and videos would be great, because by having those lined up and ready to go, they could even be at home and watch those, but they would have to watch them and take notes. They would have to watch them and be able to answer questions or whatever it is that the homework would be that would follow that. So I would say that, considering that a lot of our children today learn through videos and through automated kind of things.
Thank you so much. I appreciate it.
Thank you, Dr. Pierce. We have another question for you from Board Member Ragland.
Okay.
You need to unmute Board Member Ragland.
Sorry about that. Thank you, Mrs. Coleman, for coming back to us with this. I guess my question is really for Dr. Dixon. It seems as if there is a lot of interest in pursuing this a lot further from the board's perspective. Is there a way that we can have Mrs. Coleman work with someone from our curriculum team and our budget team in order to get the information that Dr. Pierce has already requested? One of the things that I want to do is, value the hard work that Mrs. Coleman has already done in putting this together. I think some of the questions that we've asked, we've got internal staff that can help her broaden out this proposal so that it comes back to the board in a manner with which we can properly deliberate it with a lot of the accuracy that we would like to see. And so can we assign her someone to kind of work on this as maybe a project that they can come back to us, as we go through our budget process and look at doing something comprehensively?
Yes, Board Member Ragland. What I would do if Misty, we would get all of her information and then we would connect her to the curriculum team. And then we'll follow up with the board on our next steps.
Thank you. I think that is important. Not just that we have, a member of the community and just a valued partner with the district over, a lifetime. But if we can provide the support for her in helping to really get this done, I think that this would really help our young people. So thank you for that, Dr. Dixon. Thank you, Madam President. And thank you again, Mrs. Coleman.
Thank you. And thank you, Dr. Dixon, and Board Member Ragland, and all the other board members as well. And I know if there's any more questions.
There actually is. Thank you, Ms. Coleman. One more question from Board Member Brown.
Thank you. Thank you. And Ms. Coleman, thank you for your interest and for your information. First, let me just make a comment in part responding to my friend and colleague, Mr. Ragland. Curriculum is a matter that is entirely within the purview of administration. It's entirely up to the superintendent and her team to decide what curriculum makes sense. Whether some board members do or don't like it, I think is beside the point. It's not a matter for our involvement. And I would want to leave to administration questions about evaluating curriculum, questions about what makes sense, what does not. We can help set the goals, and we have to do that. It's important. And yes, we do want Black history as a part of what our students come away learning, and lots of other things. But I think that that's important to keep in mind. Secondly, for Ms. Coleman, is this curriculum something that has been successfully implemented anywhere else? Have you provided to our administration references or reviews or success stories about how and where it's been used? Or is this something new for us here in Columbus?
It is new for us here in Columbus, but there are places like Philadelphia and that really kind of lead the way in the nation, and other cities who have implemented, some of the textbooks. And I don't have the whole list with me, but I do have a list of textbooks that have been used, and they've been quite successful. I will provide that for the school board and for the Columbus City Schools, and this is something that I think is fairly new because it has not been implemented before. There are some success stories though, and I've actually researched and read about some of those, and so I can get some of those to you, some of those articles perhaps, and some of the other things that point to the success of this. I do know that with there not being any Black history, I think what we want to do is see some kind of a balance so that it's not omitted when we have especially a school district where it's predominantly Black, like 70% Black students. And I think it's healthy for all students to know, because that's why we have I think the misunderstandings in our society, because We can't just have a one-sided learning. We need to have a holistic learning, and I believe this adds to it.
All right, thank you, Ms. Coleman. Appreciate your time and information.
Yeah, I would like to add too to the board members that we do have some, we've been addressing the need to have Black history as part of our curriculum. It's not, you know, we're still working on our PDK recommendations, remember? And having a curriculum review process is part of that. But we do have our Social Studies 8, we have added new learning targets and content elaborations under the Teaching Hard History, the framework for teaching American slavery. We also have American History 10, it includes new instructional resources on Jim Crow, the Great Migration, post-World War I, intolerance, and the Civil Rights Movement. American Government includes new instructional resources on civil rights and the expansion of suffrage through constitutional amendments. And African American Studies has a new curriculum fully aligned with the Teaching Hard History framework. So we've been making some improvements that's been facilitated by Matt Dorian in the curriculum department. We, of course, are not where we want to be. And so we have some ways to go. And now that we have some additional team members, we know that this is something that we can address with fidelity, because we have to put some other, address some other things that we don't have in place per the PDK audit. But as Mrs. Coleman and the board members, we're excited to have this discussion, to find a pathway that we are able to share this curriculum in a way throughout pre-K through 12, in a way that that we can go back and train and evaluate our implementation plan as appropriate. And then we have the leadership in our departments, various departments, to do that. So this is exciting, but I just want to remind the board and those who are listening that we have made some strides, but yes, we are not where we want to be.
So I just want to say that we have a lot of board members that really want to comment on this. And so I think that perhaps we can use let's add this to an agenda to really talk about it. I think this whole idea of providing culturally competent curriculum, it was something that we put, that Dr. Pierce wrote in, you know, calling out racism as a crisis in public education. And I know that from, you know, my personal discussions with community, as we have been working through our strategic planning process and going out and engaging the community, this is also something that they are interested in. And I also know our students are interested in it. I participated in a classroom project with Northland, a freshman class, and several of them wrote to me as part of their assignment that they wanted to see more culturally competent curriculum, specifically around, you know, Black history. And I know that we have more community members, even more organizations that could even help us implement more maybe lessons around our own Columbus Black history and you know, history for Hispanic, Latinos, Somali, you know, all the cultures that are represented in our district. So this is such an important conversation. I would really like to kind of pause the continued discussion, because I think board member Brown is correct. It is up to the administration to figure out the exact curriculum and how it is delivered. But this is one of those, you know, guardrails that I think the board is hearing about. And so perhaps we could spend a little more time discussing at a future meeting. Board member Ragland, do you have something to say?
Yes, I do. And I want to address that point specifically. That is precisely why I asked for Dr. Dixon to identify someone within the administration to work with Ms. Coleman.
She did.
Funding out this proposal.
She did.
I want to be very clear. Oh, wait 1 second. Because to me, this is exactly the problem. We don't have any minority participation. We don't have any LEDE participation in this department to begin with. Week after week, we get legislation from this department. There's no local folks. We have someone that's done yeoman's work within this community to bring this proposal to us twice now. I asked Dr. Dixon to assign someone to broaden this out. And this goes to a broader point as well.
Okay, Mr.
Because
Ragland.
one second,
No,
please,
Mr.
Madam
Ragland,
President.
Mr. Ragland, you're out of order.
No, I'm not.
I appreciate what you're saying. This was
No,
not,
you don't.
you're not talking about LED right now. That is not this conversation. You're out of order. We will move on. Dr. Dixon did provide direction to Ms. Deed to get Ms. Coleman in contact with someone from our curriculum department. So that will happen. And we will schedule this discussion at a future board meeting. So we will move on. So thank you, Ms. Coleman, for bringing that
Thank you all. It's been a
to
pleasure.
us.
And with the city schools and helping our kids with Black history. Thank you very much.
Thank you. All right, we have a second caller. We have Allison Rushmore, who is going to speak with us about the Digital Academy, specifically Ingenuity. And she would like the board to acknowledge that Ingenuity is failing our children and provide the support and resources to properly educate the CCS Digital Academy students. So we will wait for Board Liaison Nichols to join us.
President Adair, while we're waiting, can I make my quick point really quickly?
No, we are past that. Sorry.
President Adair, the speaker is on the line.
Thank you. Ms. Rushmore, you have 4 minutes. You may begin.
Thank you, Madam President, Dr. Dixon, and esteemed members of the board. My name is Allison Rushmore, and I am the mother of 2 children at Indian Springs Elementary who are currently enrolled at Columbus City Schools Digital Academy. I am here tonight representing 47 families whose collective 72 children are enrolled in Digital Academy and share my views on the following 5 failures of the Edgenuity platform, including curriculum content, workload, grading inconsistencies, teacher support, and student self-management. The Digital Academy administrators recognize these issues with Edgenuity and are diligently working to correct them. However, we need the support and resources of the school board to bring the Digital Academy education up to the level that we have come to expect from Columbus City Schools. The curriculum is not providing our children with a foundational education. The ELA content is both above grade level and below. 3rd grade sight words include the letter I. 2nd graders often have the same sight words as kindergartners, yet are expected to write full paragraphs with appropriate topic sentence in detail. This is not cohesive, nor teaching them foundational grammar and sentence structure before requiring them to publish paragraphs on a weekly basis. Math is extremely lacking in instructional value and applied practice. Instead of practicing addition, subtraction, multiplication, and division, our children are writing the numbers 1 to 1,000 by hand. This is unnecessary busy work that is taking time away from actual learning. Much of the science content is not fact-based and involves stories of talking animals, mythical creatures, and culturally insensitive content. This is not science and should not be presented to children as such. Next, there is entirely too much work for these children. This crushing workload is frustrating, and frustration breeds contempt for learning. There is no time for parents to add enrichment that will actually help their children learn, and not all parents can afford additional enrichment for their children, which widens the education gap. The Digital Academy has advised that students should complete 1 learning module per week to stay on pace. But with 18 learning modules and 16 weeks in the semester, students would have to work through Thanksgiving and Christmas break, or do more than 1 module a week in each subject just to keep up. This is not realistic for families struggling to complete suggested 1 module each week. One of the most inconsistent aspects of Edgenuity is grading. There are teachers who have not graded any assignments in the first 4 weeks of school, some who are awarding 100% for simply handing in an assignment, and others who are giving very bad grades because they are strictly following the grading rubrics in Edgenuity, which are not always grade appropriate or based on concepts taught in the lessons. Teachers in the Digital Academy have been put in an impossible situation. They are assigned to Digital Academy students in different grade levels than the classes they are currently teaching remotely. They have limited to no interaction with students. They are grading assignments for children who are just a name on the computer, and with the 10 hours per week they are paid for Digital Academy work, they do not have time to provide valuable feedback to Digital Academy students or intervene when they see issues. Lastly, Edgenuity is not student managed, but rather parent managed. A young student cannot navigate the platform on their own, and the entire program requires a learning coach, meaning a parent, to sit with a child 100% of the time and take part in the teaching process. Columbus City Schools sold this as a good option for working parents, and that is entirely not the case. We have provided grace and patience to Columbus City Schools throughout the process. We have struggled through technology issues with the system, lack of cohesive communication, constantly reassigned teachers, inappropriate and disturbing curriculum, all while working full-time, taking care of our children and family members, and trying to provide a high-quality education for our children. We have chosen to protect the health of our children and our community by keeping them out of the school building. But now that choice appears to be at the expense of our kids' education. These problems are not going to be solved unless the Digital Academy has the resources and support they need to address them. The 47 families that I represent today, as well as the more than 3,000 Digital Academy students, hope that you rise up and take immediate action. Thank you.
Thank you so much, Ms. Rushmore. I am going to have Dr. Dixon chime in prior to the board asking questions. Dr. Dixon.
Thank you, Board President, and thank you, Mrs. Rushmore. I am going to turn it over to our new interim Chief Academic Officer, Dr. Terry Breeden, but I want to state publicly that we are frustrated with Edgenuity as well. And we have been working with the team, with their team rather, on those very issues that you have raised. So know that we're frustrated. We've been working with them. We've involved other people on our team to work with Edgenuity and their team, and we have some solutions moving forward. But I would like to turn it over at this time to Dr. Breeden. She has been with the district a short time. We're excited about her. I'll do a formal introduction of her later. But one of the tasks I asked her as soon as she started I need you to help us get through what's happening with, sort out what's happening with Edgenuity so that we can provide, as you stated, the platform that our parents expected and what improvements can we make moving forward. So Dr. Breeden, and then we can get to the board questions if that's okay.
All right, I'm very happy to be with you tonight to talk a little bit about the Digital Academy. I have worked closely trying to get up to speed and understand all the problems that we're having, and the public comment we heard tonight is very representative of other feedback that we have been given. We are very concerned. We do not think this meets our standard of quality, and some steps that we have taken already is we completely stopped using the curriculum in social studies. It was inappropriate for all the reasons that we heard here tonight and for other reasons. We began also to supplement the science curriculum because it was insufficient, lacked rigor, as also our speaker pointed out tonight. Matter of fact, I have a meeting with Edgenuity tomorrow at 1 o'clock with our curriculum experts to talk further about that matter. So we do not deny these issues. I have shared with Dr. Dixon my plan for improvement, and we are working closely with HR and with our communications team and our curriculum team to right this ship. We also want to acknowledge that people, and as you acknowledged, there are people working very, very hard. This has just not gone as well as we hoped, and we are trying to fix it as much as we can. We have offered, even though some people cannot take this option, that if they have a student in the K-5 Digital Academy, that they can return to their school. We feel that is only fair since this has not met our standard, and we're working individually with parents to make that happen. There's much more I could say tonight, but that is just a quick summary of to reassure you that we are working on this and we too are concerned.
Does the board have any clarifying questions for Ms. Rushmore? Ms. Beckerly?
You know, I'm kind of going back to a theme that I've been hearkening since March, but I'm sure to the parents, it feels like this has been going on forever, and they can't believe that we haven't been able to get this fixed. But this is all part and parcel of part of the problem, which is we're clinging in the midst of this crisis to what we expect to be normalcy or normal business as usual with education. And I think that this is going to be a year like no other. And in the best of circumstances, I guess my wish for our community is that we would relax a little about things that aren't going right, because we're figuring it out in real time. And, you know, we worry so much about the loss of, you know, certain instruction and all these things, but the whole world is in a loss right now. And, you know, I totally commend our staff, our curriculum staff, and I'm happy to see you, Dr. Bradeen. We've emailed a couple of times. This is not going to get fixed overnight. And, you know, we're figuring it all out in real time while we're simultaneously trying to figure out how to do blended learning, while we're simultaneously trying to deal with testing this date, no testing this date, no testing this date. And I think that we should all relax a little. We're going to get through this, and we will figure out how to, you know, make up the gaps, whatever they are at the other end. But I would just encourage everyone to take that approach, that this is, all bets are off this year. And I can say that from having been in the classroom for 13 years and understanding what everybody's up against. So I just wanted to share that perspective. And you know, maybe put a plug in for what I've been saying all along. I would like to see our focus be on what can we do now to make sure we are hitting the ground running in the fall, accepting that these sort of bumps were inevitable. Thank you.
Anyone else?
I'd like to respond to that.
Go ahead, Ms. Rushmore.
I think that parents in the Digital Academy realize that Rome is not going to be built in one day. This is going to take time. There are going to be bumps in the road. But I think these bumps have been monumental. This has been going on for 4 weeks now. There are parents who still have never heard from their children's teachers. I mean, there are major communication issues going on, major curriculum issues. I have spoken to administrators in the Digital Academy. I agree. They care wholeheartedly, and they are working very hard to try and fix this. But I think that they need more resources to turn this around in a reasonable amount of time.
Everyone's shaking their heads. Dr. Dixon, did you want to say any last thing there?
Yes, thank you. And that's part of it, Ms. Rushmore. When we decided to move in this direction, we had planned a platform for significant less number of students than we had to move to Digital Academy. We had about, I think, 1,500 or 1,500 to 1,800 students. And then once we announced that we were going to be remote, our numbers went up to almost 6,000 students, families that wanted to go into Digital Academy. So that did shift our staffing a bit. However, the curriculum issues and those things with Edgenuity are things that we are saying to them, we're now supplementing. So we now have our team that is working to supplement the curriculum that was supposed to be provided by Edgenuity. So yes, you're right. But again, you know, we're working on it. I know you've heard that a lot But rest assured, we are, and we have some solutions that we believe are going to work best. And again, as we stated earlier, we just ask for your patience. We didn't anticipate this happening. We entered an agreement with Edgenuity, believing that some of these things would be taken care of, and they just were not. And as Dr. Breeden stated and our other teams, we are not happy either. We are looking for ways to provide additional resources. That's been the main thing that Dr. Breeden has stated. We're working with our HR team to provide those additional resources so that there's more interface for our students with the teacher. Because we realized that was one of the main concerns rather, is that our K-5 parents, they wanted more interface with a teacher. And so we're looking for ways to make sure that we provide that for our families. So we're working on it, and we are trying to come up with some solutions as soon as possible. And as soon as Dr. Breeden has that meeting, we're going to work on ways to correspond, communicate with our families on where we are moving forward.
Thank you. Thank you so much, Ms. Rushmore.
Families are scared to death that their children are going to be behind when they return to the school building next year. They are not going to relax when it comes to their child's education. So I think they just need to be made.
Thank you, Ms. Rushmore. Okay, we are finished with public comment for the evening, and the board will actually now go to executive session. Board Member Cole, I believe you have a motion.
Thank you, Madam President. The board requests recess into executive session per section 121.22 G4 Ohio Revised Code to prepare for, conduct, or review negotiations or bargaining sessions with public employees concerning their compensation or other terms and conditions of their employment.
Is there a second?
Second.
Thank you. Please call the roll.
Ms. Beckerly,
Yes.
Mr. Brown,
Yes.
Mr. Cole,
Yes.
Dr. Pierce,
Yes.
Mr. Ragland,
Yes.
and President Adair.
Yes.
That motion carried.
Thank you so much. The board will adjourn to go to executive session, and we will return to public session when we are concluded. Hi, Columbus community. We are back from executive session, and we will continue with our board agenda. We are now at item 7, public hearing on reemployment of retired employees. Item 7.1 is public hearing on the reemployment of Bruce E. Nicely. I believe that there is no one here to speak on this for this public hearing. Is that correct, Board Liaison Nichols?
Correct.
Thank you. So at this time, we will conclude the public hearing for Bruce E. Nicely. The next is the public hearing 7.2 on the reemployment of Grace M. I messed this up last time. Marskico. I messed it up. I know. I'm so sorry. And I believe there's also no one here to speak for this public hearing. Is that correct, Board Liaison Nichols?
Correct.
Thank you, and that will conclude this public hearing. Item 8, notice of public hearing on the reemployment of retired employees. We are 8.1, notice of public hearing on reemployment of Michael S. McCammon. Pursuant to Ohio Revised Code 3309.345, the Columbus Board of Education gives notice that Michael S. McCammon, Executive Director, who will retire from the Columbus City Schools effective December 31st, 2020, is seeking employment with the Columbus City Schools as Executive Director effective January 4th, 2021. The board will hold a public hearing on December 15th, 2020 at 5:30 p.m. in the Assembly Room of the Columbus Education Center at 270 East State Street, Columbus, Ohio, or a location designated for the public meeting on that date of the Board of Education, or virtually in the case of the continued pandemic on the issue of Mr. McCammon's reemployment. We have noticed that for December 15th. We will now move to item 9, the superintendent's executive report. We will continue with your report from earlier. Madam Superintendent.
Okay, I'm sorry. Oh, just a second. My screen. Report.
Dr. Dixon, we can see it. It's on your opening screen or your opening slide.
Okay. I don't see it. So you can see it from, you can see my screen or Scott's screen?
Well, we can see Scott's. It looks like it's
Okay.
Scott's screen.
Okay, gotcha. All right, my apologies. It's kind of, it always does that when Scott shares his screen, my screen goes crazy, so I apologize. Oh, just a second. Scott, just keep yours up. I apologize. I'm working on my. Okay, so thank you, President Adair. I have several updates to share with the board tonight. And first, I would like to introduce our newest member of my leadership team, Dr. Terry Breeden. Dr. Breeden will serve our district as the interim chief academic officer for the remainder of the 2021 school year as we conduct a national search for a long-term candidate. Dr. Breeden's extensive resume as an educator and leader speaks for itself. She is a Central Ohio native who has spent decades working in the school districts in Tennessee, Virginia, and Ohio. Most recently, Dr. Breeden served as the Assistant Superintendent of Curriculum and Instruction for Shaker Heights School District in Northeast Ohio. She retired from Shaker Heights in 2019. She also served as an Assistant Superintendent with Loudoun County Public Schools and Fairfax County Public Schools in Virginia. And she spent 20 years in Metropolitan Nashville Public Schools as a teacher, principal, and curriculum administrator. Dr. Breeden's experience will be an asset to our district as she leads the academic services team during these uncertain times amidst a global pandemic. Beyond just operating and teaching in a virtual environment, we have many academic initiatives ready to implement this year, from our new ELA and math curriculum to our recent PDK curriculum management audit to the upcoming strategic planning process. I'm excited for Dr. Breeden to join our team and help lead our district through these critical times. Welcome, Dr. Breeden. Our partnership registry. During this COVID crisis, our students and families have benefited greatly from support of our community partners. Everyone on this board has frequently mentioned the remarkable work and generosity of organizations and individuals throughout our city who answered the call to step up. And we're often recognized for the great work of our new Department of Engagement. Tonight, we're set to take another significant step forward in our strategic engagement efforts. Since the inception of the Department of Engagement, a question that has often been asked but never answered is, exactly how many partners does Columbus City Schools really have? We know it's hundreds, but no exact number. We also know that for our engagement efforts to truly be the most impactful for the success and support of our students, we need to know that those partners are linked and aligned. That's why the Department of Engagement is set to launch our long-awaited partnership registry. We had hoped to launch it last year, but technical challenge combined with the pandemic put our efforts on hold. During that time, our engagement team worked closely with our technology office to come up with an impressive online registry. And now we're ready to invite our partners to step up and officially register with us. This partnership registry will be more than a list, though it'd be nice to have an official listing on our website. This registry would give us real insight and information on the types of services our partners are providing, how many students they're actually serving, and which areas of the district they're working in. Most importantly, it would help us identify the gaps and overlaps in efforts so that we can be more equitable in our partnership efforts across all parts of our district and for all students who need and deserve support. We will officially launch the partnership registry on Saturday, October 10th, a date that symbolizes an equal partnership, 10-10. Also, we will use that 10-10 date to begin a monthly series of partnership appreciation days on 10-10, then 11-11, then 12-12, and so on. Our engagement team will work with our communications team to post and spotlight several of our community partners each month, our way of proclaiming our partnerships and saying thank you to those organizations who did step up and who continue to make a difference in the lives of our students and their families. Speaking of partnerships, we're excited to announce a new partnership this week with Ohio Dominican University that would be a great benefit to our CCS staff members and their families. Ohio Dominican will offer CCS teachers, staff, and administrators, as well as their spouses and dependents, an opportunity to complete a wide range of graduate degrees at a discounted rate. As the educational partner with Ohio Dominican, CCS employees, spouses, and dependents will be able to take advantage of the following benefits: waived application fee to Ohio Dominican University, ability to take as many as 3 master level courses tuition free, flexible start dates, and the option to attend class on ODU's campus during the evening, online, or possibly on site at a CCS location. This new partnership aligns with our goal to recruit, develop, and retain world-class educators here in Columbus City Schools. Any staff members who are interested or want more information should contact our Department of Human Resources. Finally, I would like to finally, we had a change in our program tonight. We were going to have Dr. Mike Casserly and his team to present our HR audit findings. But we've made a change in that schedule, and we will bring Mr. Casserly, Dr. Casserly rather, and his team back next month. So that concludes my superintendent's report for this evening. Thank you.
Thank you. Any questions on the superintendent's report? All right. Seeing none, we will move to the next agenda item, and that is the report of the internal auditor. Hello, Mr. O'Connor.
Good evening, President Adair, board members. I would like to provide a brief update of the Auditor of State report and management letter comments for fiscal year 2019. So I'm going to share my screen here. Hopefully everybody can see that. Okay, our office updates prior fiscal year Auditor of State comments by identifying the finding number, finding description, process owner, and implementation dates. In addition, our office also determines the following. Is the management corrective action plan effective? The likelihood of the Auditor of State comments repeating in the following fiscal year. Did the comment repeat? And we also provide a brief explanation of the comments that we believe have a high likelihood of repeating in the upcoming audit. So on this slide, you'll see the 2019 finding number. It's report 1 and 2. They both deal with the exact same situation, and that's the Kronos system supervisor approval of time cards. And the reason there's 2 comments is the Auditor of State has to report 1 on the internal controls over financial reporting, and then they have to repeat that same comment if it affects major federal programs, and in this case it did. We have determined that this comment should not repeat in fiscal year 20 and our fiscal year 20 audit. Our office reviewed Kronos data for all 26 pay periods for fiscal year 2020 and noted an average approval rate of 98%. So in the 2019 audit, it was 8.4% delinquent or not approved on time, and now that's down to 2%. So we feel that's a pretty good indication that that will not repeat in the upcoming Auditor of State audit. The next slide deals with management letter comments. And there were 3 of those, and our office believes there is high likelihood of 1 of the 3 comments repeating for fiscal year 2020. And that 1 comment is timely deposits, and that is because consistent application of current procedures is still an issue at the building level, excuse me. But the other 2, the internal controls of WCBE, that has a low likelihood. And the federal grants expenditure process, those are basically corrections that are not made timely. And it just depends on what their sample polls, if that is going to repeat. But again, we don't think that will. So we're rating that one as low also. That concludes the update of the prior year Auditor of State comments. Any questions that anybody might have?
Thank you. Before there's questions, would either of the audit co-chairs like to add anything before questions?
Thank you, Madam President. Thank you, sir, for providing this information for us. I do want to thank our especially Mr. Bohoric and those persons within our administration that have been working so very hard to make the improvements that we've seen over the years that we've discussed, and we're really trying to set a culture of correction where it is needed. And Mr. O'Connor spoke about that in what he presented in his report today. So especially thank you to Stan for his staff for a lot of the things that they are doing, and also to Scott Var and his work with WCBE, which has been just a very long-term effort. But you see the results of a lot of hard work for some folks inside this district that are working to improve our daily processes. And I'm very proud of that. My last announcement is the next meeting of the Audit and Accountability Committee will occur on October 29th. That is a Thursday at 3:30 p.m. We will meet in person at 270 East State Street in the Cabinet Room. So if you'd like to attend and see what Kevin and our internal auditor are doing on a day-to-day basis, please join us at 3:30 on October 29th. And I don't know if Co-Chair Beckerly has other comments, but thank you for the opportunity, Board President.
Board Member Beckerly, you do have a comment?
No, I don't have anything at this time.
Okay. Are there other questions from the board? All right. Seeing none, thank you so much, Mr. O'Connor. Always nice to have you fill in.
I appreciate it. Thank you.
All right. We will now move to item 11, which is the report of the treasurer. Hello, Mr. Treasurer. Do you have
Oh, Board President Adair, how are you?
I'm okay. Do you have a report this evening?
I really don't have a report. Thank you, Board Member Ragland, for the compliment. That all lies with my staff and the work that they've done. It's a good example of dedicating resources to those issues to make those changes and effectively removing those items from the audit report. No report from me this evening, just a comment that we will have a Finance and Appropriations Committee meeting on a week from tomorrow on the 14th. I didn't know ANA was going back to in-person meetings, but Board Member Cole and I have not talked about meeting together in person. So we're going to go virtual until you hear otherwise. We'll have a Zoom meeting set up for the 14th, and that is at 4 p.m. sharp.
Thank you. And so let me just pop in about in-person meetings. So it is the intention to go back to trying, we're going to call them hybrid meetings. As soon as our students, our CCS scholars step foot in our buildings for hybrid. We do need to make sure that all safety protocol for these hybrid meetings are followed. And my preference is that we use our bigger space at 3700 because we can spread out bigger. So if you're interested in any of your committees to start in that, so basically people that are essential can be in person, but we still have participation via this forum, virtual. We are working that out. I actually had a conversation with Board Liaison Nichols, and so we'll provide more guidance about how to do that and the ways we're going to do that safely for everyone. So thank you for that random reminder so I could tell you all. Were there any comments from the finance co-chairs? No? Okay. All right, we will now move to item 12, board matters. We are going to have the first reading of the omnibus amendment. So I'm going to turn it over to Board Member Brown, who chairs the Policy Review Committee.
Thank you. And since it's fresh and just spoken about, Policy Review Committee, which is presenting 1, 2, 3, 4, 5 policies for first reading this evening, is meeting this week on Thursday, October 8th at 8:30, and we will be meeting virtually. And I too look forward to meeting in person as soon as we can do that safely. And I think that the hard part will be when seeing people, to refrain from hugging and things of that sort. It's been a long time. In any case, we've got 5 policies here for first reading. The first is 1615, dealing with use of tobacco. And that policy is pertains to administrators and simply mirrors the policies that are already in place for professional staff and for classified staff. It's not really any change, it's simply correcting the omission. The next is 2464, which pertains to gifted education and identification. And this one simply adds emphasis to certain requirements. The requirement specifically to provide an opt-out of services for students, and it addresses the need to follow prescribed timelines. The current policy does it. This is not really a change in policy, but this is comes from Neola, and they're looking for greater specificity, so it does that. The next is 3120.04, pertaining to employment of substitutes. The revisions to this one reflect changes made for substitute teaching licenses. The law changed modestly, and as a result, the policy language needed to be made along with that. Same thing for 4120, which deals with the same issue as to classified staff. Licensure requirements have changed slightly, and we just make a corresponding change. None of those policies were in any way controversial or raised issues, even though the Policy Review Committee likes to be diligent, even as diligent as the committee is. There was really nothing here that warranted much discussion. The next policy is new entirely, and it's policy 8000. And this one pertains to states of emergency. This was not something that anybody necessarily gave much thought to before March. But since that time, we've learned a great deal. And this simply allows the superintendent under fairly tight restrictions to declare a state of emergency for well-defined situations that involve imminent threat of welfare or safety of students or employees, and include declarations made by the city, the state, or the federal government. And there's a procedure, and there's safeguards, and it's pretty well worked out. The committee did a lot of discussion and work, and I think what's presented here is a very straightforward piece that addresses these matters. And unless there are questions, these are all available to you, and they'll be back at the next meeting for a second reading and adoption. Any questions now?
Looks like there's no questions, but board members, after you review, if you do have questions, please send those to Board Member Brown and Dr. Roush, and they can, get those answered or changes incorporated before the next reading.
Great, and I should have asked earlier, Dr. Roush, if I got anything not quite right, please go ahead and correct me publicly. It's fine.
Okay. All right. Well, this will constitute the first reading of the omnibus amendment to board policy. Thank you so much, Board Member Brown. All right, board members, we are now going to be voting on our consent agenda. The consent agenda this evening, that looks like a typo, Misty. I think it's 13.1 to 28.3. That's what constitutes our consent agenda this evening. Does any board member wish to make a motion to remove any item from the consent agenda? Okay, hearing none. Is there a motion to approve the consent agenda?
So moved.
Is there a second?
Second.
Any discussion on any item on the consent agenda? Seeing none, please call the roll.
Mr. Brown,
Yes.
Mr. Cole,
Yes.
Dr. Pierce,
Yes.
Mr. Ragland,
Yes.
President Adair.
Yes, with the exception of 24.1 on which I abstain.
Ms. Beckerly, Ms. Beckerly, just raise your hand to indicate yes. Okay, there we go. Thank you. That motion carries.
Thank you so much. We will now move into board announcements. Board members, do you have any announcements this evening you would like to make? Okay, so we will go with Board Member Beckerly, then Board Member Brown. I have some. Anyone else? Okay, so Board Member Beckerly, we'll start with you.
Okay, I think Scott Wortman's gonna help me with my video. Can you guys hear me?
Mm-hmm.
All right, good. Happily, I have some more examples of our CCS community rising up. Okay, these people, exclusive of me, are Myra Talley from our a supervisor in our ESL department, and Mike Nicholson from Battelle for Kids. And I want to give them a rise up acknowledgement because they were working on Sunday when this screenshot was taken to get the surveys for our Safe Schools Working Group, the Safe Schools Survey, translated into multiple foreign languages so that we can get more input from our community. All right, Scott, if you wouldn't mind. And to give a plug for our Safe Schools Working Group, we're going to show you the video that our chairman and Dr. Dixon, some of our students put together to encourage participation. And I believe, as I speak, our board liaison, Misty, is putting the link to the survey in the comments. So Scott, if we could hit the, there we go. In the public comments on Facebook, I meant to say.
Every day I walk into my school, I like a positive environment. That's what makes me feel safe. A safe school for me is no bullying and no cuss words. Safe school is when no one fights and no one gets hurt.
Safe school for me is no bullying, no fighting, do what you're supposed to, get good grades, and that's it.
Safe schools for me have safe people, safe teachers, and a good community.
Safe school for everybody. They should be protected, and they should get good grades, and they should be doing their homework good.
Hello, Columbus community. I want to remind you that there is still time to submit your feedback about the safety, security, culture, and climate of all Columbus City School buildings. The information we receive from you will help inform the Safe Schools Working Group, which will present recommendations to the Columbus Board of Education this fall.
I'm Kimberly Mason, a proud parent of Columbus City Schools. And I'm Charlita Tavares, a proud alum of Eastmore High School. And we are the co-chairs of the Safe Schools Working Group. We are dedicated and invested in the emotional and physical well-being of our students, staff, teachers, and administrators for CCS. And now that you've heard from our superintendent and our students, we need to hear from you. Please complete the survey in the link on your screen.
So, and two more things. Everyone, if you haven't submitted this, completed this survey, please do. Teachers, staff, every classified staff, we need the entire community's input in order for our working group to be able to make an informed decision or recommendations for us. So please share with it, complete the survey and share it as well. The other thing, I am totally remiss. That video was brought to you by the incredible work of our communications team, Scott Wortman and Tyler from his staff, who did an incredible job on a very short time frame. And we are grateful to everyone who's working to help us get the input we need in order to have the working group do the job that we are asking them to do. So thank you. Okay, this is the next one. This is kind of cool. Amy Bonner is a math teacher at Whetstone, and it turns out that she is demonstrating how you use technology in an incredibly effective way that you might not ordinarily be able to do it. So what she does is she sends videos to parents or to students or to anyone who's asking questions and talks them through their question using a video. And in this case, it's about getting acclimated to the new platforms, but it's an incredibly effective use of technology. It gets out the need to be able to write and to read, and if a picture says 1,000 words, a video says 10,000 words. So I want to give you a sample of how powerful this way of communicating is in terms of with our families and our parents. And even, you know, it eliminates a lot of the barriers that have existed before in terms of communication. So take it away, Scott. We'll just watch a bit of it.
Good morning, parents. I wanted to walk you through our classroom this year, give you a sense of where and how your students are accessing their classwork, and then how where you can go to look to best support your student and make sure that they are staying on task and keeping up with their work. So the particular class I'm going to focus on is our first period algebra class here at Whetstone, and they will start their day in Google Classroom. That's where they'll sort of go to find their work. So they start at the front page. We're going to click on classwork. You'll notice that all of their weeks are, I'm filing all of their assignments by week. That seems to help keep them better organized in the world of virtual. Their resources, if there's something that I need them to be able to access whenever, will be up top. And then each of their weeks are filed, and they can find their individual assignments. So as an example, I'm going to focus on this particular week here, 9/28 through 10/4. You'll notice that the dates of the week always run Monday through Sunday. Monday is the beginning of our week. We'll be working on these things throughout the week, and then I give them up through Sunday to get those items done. If for some reason they're having internet challenges, stuff's coming up throughout the week, they will have that ability to get those items completed throughout the weekend. So on this particular week, on Monday, we were working on a textbook lesson. I'll show you more about that on the textbook specifically, but they would open up the lesson, or they would open up the assignment. These are their click strokes to get to the location of their assignment. Start at Clever, Miss Bonner's page, McGraw-Hill is our textbook publisher, and then they'll choose their Reveal Algebra 1 book. I will give them some directions for how to, or what I want them to do. And then I also attach a video where I've pre-recorded me working.
I mean,
Carol, you muted yourself.
Sorry. Anyway, I just thought that was a really incredible example of technology closing all kinds of gaps, and I thought it was worth sharing. And thank you to Ms. Bonner for giving us some insight into the power of these tools now that we have them. Okay, and the last example of CCS rising up is Latrice Jones, who apparently has the nickname in Region 2 of being the diva of data. And what Ms. Jones did was offer evening sessions. She called them Reconnect sessions to all of the secretaries in her region with the purpose of going over changes to Infinite Campus, answering attendance questions, and doing an overall wellness check and making sure everyone could see each other in a socially safe and distant way. And these were incredibly well received. So Scott, if you click to the next one, because we're going to also celebrate all of the secretaries who went to the evening sessions. We have Deanna Hanna from Oakmont Elementary, Daphne Mason from Leawood Elementary, Brenda Jackson from Columbus Iota, Samuel Woodward III from Independence High School, Yolanda Drew, Independence High School, April McElroy, Independence High School, Rebecca Caramal from East Haven Elementary, Nanette Carr from Walnut Ridge High School, Tanya Hill, Walnut Ridge, Tina Hunter, Walnut Ridge, Yolanda Morgan, Columbus Preparatory School for Boys, Jaleesa Moss, Johnson Park Middle, Rosea West, Johnson Park Middle, Judy Walker, Sherwood Middle, Bonita Search, Yorktown Middle, Yolanda Towns, Yorktown Middle. Barbara Blake from Beatty Park Elementary. Ms. Blake has been in the district for 30 years. Can you imagine all of the changes in technology she has lived through? And she was the one who tipped me off to the nickname Diva for data. Robbie Banks from Broadley Elementary, Kelly Westbrook from East Haven, Dara Ikes, I hope I said that right, from Fairmore, Keisha Woodson from Liberty Elementary, Tracy Ritchie from Liberty Elementary, and Rakia Elder from Old Orchard Elementary. And that's it. So once again, thank you, Columbus City Schools, for rising up.
Thank you for sharing, Liz Carroll. I certainly learned some stuff from the video about how to navigate Google Classroom, so I probably need to finish watching it. Excellent. Thank you so much. All right, we will go to Board Member Brown.
Thank you, and I too enjoyed the videos, so that's great. There's just two items that I wanted to mention, and they are both incredibly important for all of us and everybody in the listening audience. First is voting is underway. As of today, you can go in person to the Board of Elections and vote. And it is very easy to do. And they have taken great precautions to make sure that everybody will be safe and healthy and not become infected by COVID as you vote. There will be voting available for lots of hours between now and November 3rd, Election Day. If you'd rather vote in person on Election Day, please do that. If you'd like, you can still request an absentee ballot by mail and receive that and fill it out and send it back. But there hasn't been an election in my lifetime that may be more important than the one underway right now. And please, when you do go vote, however you do it, remember to vote the entire ballot. Oftentimes judges get forgotten about. Sometimes it's school board members that are at the end of ballots. There are no school board members on the ballot this year anywhere in Ohio, but please do that as well. You can get more information at the Franklin County Board of Elections. Secondly, through the outstanding legal work of some folks around the country, the courts have declared the census will remain open for additional people to be counted through the end of this month, through the end of October. That's important. While the count in Ohio hasn't been bad, there's lots of room for improvement. And as I think everybody here in this audience knows, the census and being counted, getting this right, affects millions of dollars that come to schools based upon population, that come to regions based upon population. And it is incredibly important that you be counted, and it's very easy to do. You can do it online. So please make sure that you and everybody who you can reach out to takes advantage of the opportunity to be counted. Thank you.
Thank you. Okay, we will now go to Dr. Pierce.
Thank you very much. So first, I want to thank all of our educators in the Digital Academy. I've had the great pleasure of interacting with a number of those educators. You have been working long hours to ensure that you're advancing student learning in our district. We appreciate you. Thank you very much. My second thank you is to all our parents and community members who have been writing us emails and advocating for students. Some of those emails point out our challenges and issues, but there's also emails that encourage us and cheer us on when we are doing positive things. So thank you to all our parents and community advocates for keeping that line of communication open, for trusting your board to deliver messages, to ask the tough questions. We are here to serve you, and we appreciate your engagement. Another thank you to our athletes, coaches, our bands, the South High School ROTC, our cheerleaders, security officers. I tried to hit up every football game that we have played during regular season, and I saw all of our students absolutely giving their hearts out. Even when they lost, they were happy because they were with their peers. They were doing something that they love. They had the community cheering them on, as well as their family members. And so I want to, one, just say congratulations on a great regular season, and two, encourage everybody to cheer our teams on as they move into the state playoffs. Some of our teams are taking that challenge on, and they're going to play a number of OCC schools, some of those schools that everybody says is really good. Our schools are really, really good, and we're ready to take on that challenge. So, hey, we are cheering you on and can't wait to see you all win. I want to also say today is the first day of voting, and it's so very important that we not forget the socio-political context in which we live. Jonathan Price was murdered this week, a Black man working and supporting and advocating in our community. Our students are living this reality. Our students are living this reality. Take the time to have a conversation with one of our young people, to just check in and see how they feel about not just what they see in their communities, but also their ideas for improving the future. It is a true disservice if we dismiss and don't engage our young people in helping us to craft and create the ideas to improve not just our school system, not just the city of Columbus, but the world. So please, I implore all of you to have a conversation with our young people about what's going on in this world and how we can fix it. And after you have that conversation, commit to do something to change it. Commit to do something to change it. Again, thank you so much to the entire community. Please continue to support our Columbus City School students as we continue to advance student learning.
Thank you so much, Dr. Pierce. And on that note, and in conjunction with what Board Member Beckerly was talking about, our students are receiving through their social studies teachers surveys for the Safe School Working Group. And because it is essential that we have your feedback, students, we really want to encourage you to take it. And we want to thank the teachers who are incorporating that into their lessons as a real world point of how democracy works and how government works, because youth voices in this are critical. And so please, students, please take a minute and complete that survey. Your voices are absolutely essential to this. I want to thank the students who are participating on that group, and all of the community members and our co-chairs who are taking the time and volunteering to really help create recommendations that are going to move us forward in the area of school safety. That group meets on October 15th at 6 p.m. You can watch them on live stream, and that will be their next meeting. I also want to put in a kind of a shout out, a plug, whatever you want to call it. We have started the facility master plan process, and there is an application right now out there to seek community members. So if you are interested in working on the facility master plan, you can go to the district website to find that application. It's also been posted on social media. I know I just shared it earlier today. The deadline to apply is October 18th at 11:59 p.m. So you have all day on the 18th. If you aren't interested, but you know somebody whose voice we need in a community that we need, please encourage others to participate in this. It's extremely, extremely important. And the last announcement I want to share is I just always like to highlight our graduates. And so tonight we approved several diplomas for the Ohio 22 plus adult high school education. And so I'm not going to read them, but I'm proudly putting them up on the screen, congratulating you for receiving your CCS diploma for graduation. So congratulations, graduates, and we are so excited for you. So maybe we can share those on social media since Misty made me this beautiful little slide. So congratulations. Those are the announcements that I have. I think, James, Board Member Regland, did you have something? Okay. Any other announcements this evening? Okay, well, seeing none, can I have a motion to adjourn?
You may. I'll move to adjourn the meeting.
Thank you. Is there a second?
There's a second.
Thank you. Please call the roll.
Dr. Pierce,
Yes.
Mr. Ragland,
Yes.
President Adair,
Yes.
Ms. Beckerly,
Yes.
Mr. Brown,
Yes.
and Mr. Cole.
Yes.
Motion carried.
Thank you so much. Thank you, CCS community. Thank you, all of our wonderful staff. We have a lot of work to continue to do. You will be hearing lots more communication from us, and we are all in this together to move forward for our CCS scholars. So good night, everyone. Have a wonderful evening.
Good night. Thank you.
Good night.